Does regenerative medicine work for knee pain? Your orthopedic may have talked to you about different options, maybe a cortisone shot, a brace, maybe take some Tylenol, and then eventually a knee replacement. What's often not mentioned is that there's regenerative medicine, and it's been around in the United States for decades, and it's something that this video we're going to uncover. What exactly are regenerative medicine treatments? What's available? What's more fringe? Hopefully by the end you'll have a better solution when it comes to ideas on how you can regenerate and get rid of knee pain, maybe without surgery. Or for those of you who have had surgery, maybe there's some things you can do to accelerate the recovery and to have the prevention of future surgeries. And so while there's many of these control trials for knee osteoarthritis, there's some very exciting things we'll touch on when it comes to stem cells, exosomes, peptides. And so I'm here to help you differentiate between what's spending your hard-earned money on versus maybe what's not. So I'm Regan Archibald, for those of us who haven't met. Welcome to the community. I make these videos because I see a lot of people in pain, a lot of people walking around with chronic disease, and I don't want you to be one of them. I want you to live your life to the fullest. You look your best, feel your best, perform your best at any age. And for those of you who are looking for personalized protocols when it comes to peptides, regenerative medicine, and even supplementation, just go to agelessfuture.com, get your blood labs ran, and my team of providers will help you access 503A compounding pharmacies and regenerative medicine that is world-class. Okay, so let's jump into knee pain. So why do we have knee pain in the first place? Well, there's some strong clinical data. The American Journal of Sports Medicine, 2025, they took an analysis of 18 randomized controlled trials covering 1,995 patients. The primary question: does PRP, which is known as platelet-rich plasma, a concentrated preparation of your own blood, platelets that are injected into the joint, does that produce clinically meaningful improvements in knee osteoarthritis? You know, not just a statistical improvement on a scale, and the answer was yes. And with an important qualification, PRP produced statistically superior improvements on the WOMAC score, the standard measurement of knee pain, stiffness, and function at 3 months versus the placebo. And it also outperformed placebo at 12 months. So the vast pain improved at 3 months, exceeded the minimal clinical importance difference, but platelet concentration was decisive. A high platelet PRP, so if you have healthy blood, don't do this if you have unhealthy blood, and the younger you are, the better this treatment will work. High platelet PRP showed improvements of almost 21.49% at 12 months. Low platelet PRP showed no statistically significant difference from the placebo at 6 months. So if you have platelet-rich plasma, that's the PRP, versus platelet-poor plasma, there's a big difference between the two. And so the American Journal of Sports Medicine in 2017, what they tested is bone marrow aspirate concentrate, a preparation derived from bone marrow that contains MSCs along with growth factors. And what they found in 25 patients with bilateral knee osteoarthritis, each serving as their own control, they got bone marrow in one knee and then saline in the other knee. Pretty interesting. Both knees improved significantly in pain scores at 1 week, 3 months, and 6 months, and there's no significant difference between the bone marrow aspirate and saline at any time point. So that was kind of a bummer in 2017, but what they found is that doesn't mean they do anything. They just realized that any regenerative treatment, it needs to be measured against what's being turned on and what's being signaled. Here's one of the interesting things. Well, in some of these treatments, especially with the bone marrow, there were some risks, and the trade-off was that the post-injection pain and swelling occurs in roughly 10 to 18% of the PRP-treated knees, more frequently with leukocyte-rich preparations. The bone marrow aspirate, the harvesting of itself of the bone marrow, the iliac crest, that carries significant risks. I mean, pain, bruising. A lot of people have no idea it would be that painful. And so one of the things that you'll also find is if you're pulling out visceral fat, this is like a small liposuction procedure, that can also be tough to heal from. And so even in this stem cells that you find in the visceral fat or the subcutaneous fat, there's going to be elevated levels of inflammatory cytokines like interleukin-1 beta. You'll see some tumor necrosis factor alpha. And so there could be some issues with that in and of itself. Now, this is one of the reasons why when we got into stem cell therapy, I was snowboarding down the mountain at Park City Mountain Resort, and I had a skier cut right in front of me. And so I had two choices. I could either hit a tree or hit a skier, and I love trees, so I took out the skier. And when I got up, I knew my shoulder was wrecked. So I ended up trying several different treatments. I tried PRP, acupuncture, dry needling. I did PRP multiple times, and ozone. I finally found that nothing was seeming to help, and so that's how we got into stem cells. I ended up working with some doctors out of Texas. They sent in a vial of umbilical cord stem cells. We injected my shoulder, and I had a massive recovery. And I said, this stuff works. I ended up tearing my meniscus, having pretty significant knee pain. A couple years later, used the same type of treatment and had a remarkable response, and that was after everything else failed. And so to date, we've worked with over 25,000 people using these stem cell technologies. And I can tell you, knee pain is where we have some of the best benefits. Now, this is interesting because it's your body's own regenerative properties. Turning on these markers can allow you to downregulate the inflammation and get out of pain. One of the new studies is with retatrutide, and they're finding in the TRIUMPH-4 studies, people with osteoarthritic knees, 76% of participants in the highest dose, that was 12 milligram per week, they had a significant reduction in pain, a meaningfully significant lowering of pain. Even in tirzepatide, which is a dual agonist GLP-1, they found that there was a reduction in systemic osteoarthritis in the knees. So if you can look at all the different treatment modalities, maybe there's a way with regenerative medicine, like using some umbilical cord MSCs or stem cells or something like mu cells, and then you look at GLP-1s like tirzepatide or retatrutide when that's out, even BPC 157. There's a lot of really good evidence and data. I've got videos that we've done on how does BPC 157 work and how long does it take to work. But one of the studies is where they injected BPC right into the articulation of knee pain, and they found that there was a massive drop in inflammation. There was a promotion of angiogenesis, so the formation of new blood vessels. So when we're looking at regenerative medicine, and especially with chronic knee pain, I can tell you knees are one of those things that the struggle of just trying to walk up and down stairs can be devastating, and then getting knee replacements, if we can just keep your knees healthy enough, there's so many amazing things coming on in regenerative medicine. I'm in a group called Da Vinci 50, and Dr. Gustavo Moviglia, his daughter Teresita, they're working with Wake Forest University, but they also have their own stem cell clinic down in Argentina. And they're taking induced stem cells and mapping it with one of your lymphocytes, and they're finding that they have very safe regenerative medicine protocols that can regrow cartilage and meniscus and tendons. It's really exciting. We're trying to bring that to the United States under proper clinical trials. So hang in there. Try to not get the knee replaced if you can help it, because there are solutions that work. You just need to know the right team to work with. And so for those of you who are looking for a great team, looking for regenerative medicine, all you need to do is go to agelessfuture.com, set up a call with one of our regenerative medicine specialists, and find out if this is right for you. I'm Regan Archibald. Thanks for being here. I'll see you on the next video.